RSV stands for respiratory syncytial virus. It is a common respiratory virus that usually causes cold-like symptoms. However, infants have a high risk for severe illness and hospitalizations because their airways are smaller and also their immune system may be more weakened at this stage of life, so they can't fight this virus as easily as adults can. RSV is the most common cause of bronchiolitis. It's a common lung infection in infants and younger children. It happens when the smaller air passages in the lungs, called bronchioles, become inflamed and clogged with mucus. And when this happens, it causes them to have increased work of breathing, and so it's really important to keep your eye on your infant if you start seeing them have these symptoms. Pneumonia is an infection of the lungs, and that is a complication that can also happen from RSV. It causes the air sacs, what we call alveoli, of the lungs to get inflamed or fill with fluid or pus. Pneumonia is usually caused by bacteria or a virus, which also may include RSV as the cause. RSV prevention tips goes back to the basic stuff that we all know about proper hygiene. So when you cough or sneeze, use a tissue or use your upper shirt and sleeve, not your hands. Wash your hands often with soap and water for at least 20 seconds. Avoid close contact, such as kissing, shaking hands, and sharing cups and eating utensils with others. Clean frequently touched surfaces, such as doorknobs and mobile devices. Try to avoid other children and vulnerable adults when you're sick. And get the RSV vaccine for adults if you're eligible. Or if you're pregnant as a mom, try to get it during your pregnancy so that you can protect your newborn. And make sure your baby gets the RSV immunization if they're eligible. You may need to take additional precautions if your child is a high risk of RSV. Limit the time they spend in child care centers or other potentially contagious settings, especially during fall, winter, and spring. This may help prevent infection and spread of the virus during the RSV season. Keep in close contact with your healthcare provider if your baby is having difficulty breathing, not drinking enough fluids, or experiencing worsening symptoms. These are signs of severe illness and may require hospitalization.